Pandemic began last March, or they've even developed a new condition altogether. This is according to a new poll from CS Mott Children's Hospital in Michigan. I spoke with mental health advocates to talk about the challenges that today's teenagers are facing. Listen.
Growing concerns about the mental health of younger Americans during this pandemic.
Recently, there's been a large increase in calls about loneliness or connectivity, having issues.
Elise Troker is on the front lines of the mental health crisis with teens. She's a part of Teen Line, a nonprofit community-based organization offering peer-based support using a national hotline.
I would say we've had an increase of more serious calls and more serious topics: suicidal ideation, child abuse, and self-harm.
A CS Mott Children's Hospital poll finding recently that teenagers are feeling frustrated, anxious, and disconnected due to the pandemic. And according to an examination of medical claims by healthcare nonprofit Fair Health, for the first full month of the pandemic compared to April 2019, the number of claim lines among teens aged 13 to 18 related to self-harm nearly doubled. Claim lines for overdoses shot up nearly 120%. And for generalized anxiety disorders, a nearly 94% increase. A startling reality as some teens head back into the classroom.
I mean, you would think getting kids back into the classroom would be a good thing. This is surprising.
From getting up in the morning, having the structure, getting back inside the classroom, really focusing, paying attention, having kids around you, all this, can create a lot of impact on your mental health.
Clinical psychologist Regine Maradian says there are essential conversations you need to be having with your teens to help, including discussing what things were like pre-pandemic and what things look like now.
Really practicing something I love is active listening, and that's really stepping back and validating how they feel and validating their frustrations and where they're coming from, because they may tell you, oh, everything was great, but in reality, they may be struggling internally.
There's no one size fits all for what this experience has been like. And even with how people are feeling, it's super fluid and it fluctuates from time to time, where in the beginning of the quarantine and the pandemic, maybe you felt in control and you felt like you could do things. Everyone is in this crazy world, but everyone is living it a little bit differently.
While these emotions may be different, the need for help remains the same. Both of them agree. Teen Line can be accessed by going to teenline.org. And Dr. Maradian is lobbying Congress to provide mental health training for teachers so they can support these students. It's called Teen Project Rise, and you can learn more about that on the Teen Project Rise Instagram page. More HLN is next.